Okay, so now we're gonna do just a real quick review of the stretches for the lower extremity. I'm not gonna go over it as in depth as I did with the upper extremity because hopefully the education that we already went through with that, you guys remember. If you don't, that's why the video's there, so you can always go back and review it. What I want you to do is just go ahead and lay comfortably, but without your back extended like that. So in stretching the lower extremity, obviously we would start with the hip, and from the prone position we can get basically 4 stretches of the lower extremity. So I'm going to have Karen just lift your leg up for me if you don't mind, and you can have them bend their knee, kind of helps. And we're going to stretch the hip flexors here, so we're going to move her more into extension. With this, you want to stabilize up here. Be careful with your hand. You don't want to put your hand here and kind of grab their butt, okay? So you want to make sure that you either kind of put it here, make a fist, or go just like here. I kind of prefer putting my arm here. So we're putting our arm on basically the PSIS, posterior superior iliac spines, to kind of stabilize the pelvis as we stretch. So I'm going to reach under here and I would just move her into, and she actually does have a little bit of tight hip flexors. So I would get her to the end range of motion here and hold for 30 seconds and then bring it back down. Once again, you can do this in standing too. I'm just not, because I'm tall, and it makes it a little bit difficult for the cameraman. So that's for stretch of the flexors. So if their flexors have gotten tight, if they don't have full extension, we just move them into extension, hold for 30 seconds, and then relax. Just remember, get to that end range of motion and then try and go past just a little bit. 30 seconds to a minute is best, but cyclic stretching is a viable option also. So from this position, we can also do both internal and external rotation. Just be careful with this. We still want to stabilize here. Watch that hand placement. The other thing you have to remember is whatever direction the foot goes, the hip is actually technically doing the opposite, okay? So we're moving her foot out, but the hip and the femur are rotating internal. So I am moving her into internal rotation, which means I'm stretching the external rotators. Okay, so I would get to that end range of motion and hold for 30 seconds and then relax and bring it back. Just remember, from your PowerPoint, you don't want to overstretch. So you need to know your ranges of motion, your normal ranges of motion, and you don't want to go beyond that. We don't want hyper mobile joints. We want to remove hypomobility, but we don't want ever to increase stretch into hypermobility, because it causes joint laxity and can cause problems, especially later in life. Okay, so we just moved her into internal rotation of the hip, and we're stretching her external rotators. You can do the same for the other side in the opposite direction. We're moving her now into external rotation and we're stretching the internal rotators. Same thing, hold for 30 seconds. So we've got that there. The other position that we can, let me grab a towel. The other thing, I'm going to put this just under her knee. So I'm putting this on a little bit of a stretch actually already, and I'm going to stretch her quadriceps muscles here. So I can move her further into knee flexion here, thus stretching her knee extensors or her quadriceps. Get to that end range of motion, which she's actually at probably easily 150, 160 degrees, so we don't want to actually hyper stretch her. So, but you will find lots of patients, especially working with elderly population or in a skilled nursing facility, where this is really reduced. And so you'll get to about here and that's all they can handle. And then so just hold for 30 seconds. Once again, this is a multi-joint muscle because the long head, well, which is not technically the long head, it's the rectus femoris, but the rectus femoris crosses both the knee and the hip, if you remember from 116 and 125. So if she's able to do this well, then we can add in that other component like we did with the triceps and increase here into more hip extension as well to put that rectus femoris on a longer stretch. So I'm going to have you, if you don't mind, roll onto your left side, and I'm going to show you the stretches for hip ab and stretching the abductors and the adductors. So, and also while I do this, I'm going to show you a stretch for the IT band, which is very, very similar and a very common thing, and we'll talk about that here in a second. So Karen, what I want you to do is scoot back. I'm going to be right here, so I won't let you fall. Be right there, you go, right there on the edge. So I want you to bring these legs, both your legs kind of straight. So for abduction, if I'm stretching the abductors, which abduction is this, so I want to do the opposite, right? So I can't truly go down through her leg, obviously. So what we do is we have them do just a bit of extension. I want you to go ahead and put your foot normal though. And we push down. Is that tight?
Not really.
Not really. Actually kind of surprising. So stabilizing here, okay, at basically the top of the iliac crest, kind of on top of the greater trochanter, just to stabilize and make sure, and we would just push down past, get to that end range of motion, and hold for 30 seconds, and then bring it back, okay?
I can feel the stretch in my hip now, and it feels good.
Yeah. So Karen actually does have a tight IT band, and I'm going to show you how to kind of focus on that. So remember, we talked earlier about the key to stretching certain body parts, is, especially if you want to focus on one muscle, is to go, okay, well, what are the actions of that muscle? And now I'm going to do the opposite. So we have the TFL that sits here, and it flexes and abducts and internally rotates. So if we really want to stretch the TFL, which is attached to the IT band that runs all the way down here, along the length of that, we want to do opposite of all that. So we're going to extend her past a little bit more. We're going to have her externally rotate that hip, and then we're going to kind of push down into abduction. Adduction. So we're stretching that TFL. So she should feel a stretch here and all along this. This is a really common tight area for people, especially in runners, which will cause a condition called IT band syndrome. And what happens with that is this band that actually attaches to the TFL and the gluteus maximus, if you remember, it attaches all the way down here and actually even attaches to your patella and part of your leg here. And so what happens is when that gets tight, it actually causes the patella to track the wrong direction, and it will get caught. And that band itself, when you move past 30 degrees of bend, will drag across the lateral condyle of the femur and will cause a lot of pain. And so you'll get what's called runner's knee, and it's caused by a tight IT band. So you can stretch it that way. The other thing you can stretch here is obviously if they have tight adductors or are not able to fully abduct the hip, which she does not, we can move them into this position and hold it. This is actually best to do standing because, and I'm going to show you with this number because I want you to see it. So we raise her up a little bit. The nice thing here is, like I said, you can get the shoulder kind of in under the leg here. You can stabilize the hip here. If this leg is coming up, you can wrap a towel around it and put another leg up here and kind of hold that in place. and you just stretch. She's fine there, but you would get to that end range of motion and hold, push past that end range of motion and hold it for 30 seconds to a minute. Okay? All right, so I'm gonna have you roll onto your back now. And scoot, go ahead and you can scoot in.
That all felt really good and made my booty feel better too.
Yes, because you really do have a tight IT band. So. Okay, so the final stretch that we can do is for the hip extensors and the knee flexors, because that is the I'm gonna go ahead and sit back down. Well, I need to stand for this one actually, but because that's mostly your hamstrings that are doing that action, we can do that all at once. So if, once again, this is one of those ones that is a multi-joint muscle, and so if they're super tight, I'm actually going to have you roll onto your stomach again real quick, I'm sorry. So if they're super tight, you actually want them in supine, because what will happen is the hamstrings are tight here. They're not able to extend their leg at all. Once again, this is one that can be very common. People who sit in wheelchairs for long periods of times will get stuck in this sitting position, and you can push them down into more extension, stretching the hamstrings. Same concept there, so you just kind of stabilize here. Be careful not to get too high, and push down here. But if you can still have tight hamstrings even if you're able to extend your leg all the way down. So that's when I'm going to have you roll back over. And this would be the stretch. And so this is one of those ones again that's a little bit more complex. So I'm going to lower her some, and I'm going to kind of raise here. So what you can do here is you can take a towel, wrap it around to where both ends, the top end and the bottom end, are right here. Set your knee on top of it, and then you can kind of stabilize the hip here. You're keeping this leg from moving, and you're moving them more into a stretch of the hamstrings here, which she does have a little bit of tight hamstrings. So I'm going to make sure that they're not bending the knee. If you get to the point where you're bringing them up and their knee starts bending, you know that you've hit that point where the hamstrings are tight. And you want to get them to the point, keep the knee straight, and then stretch from there and move them further and hold it for 30 seconds and then have them relax. And finally, we've stretched the hip and the knee. You can do obviously feet as well. So basically just the 4 ranges of motion there are, if they're stuck into kind of plantar flexion, this is really common with especially ladies who wear heels. They don't bring their foot up into dorsiflexion enough, so you just do the opposite. So if they're stuck in plantar flexion, bring them up, get to that end range of motion, stretch for 30 seconds, and move down. You can stabilize here. I like to kind of hold just under the ankle. You want to support here under. I like to keep my hand there. The other thing is you can grab with this hand under the heel and use your arm to kind of give you a little bit more leverage and push them further into dorsiflexion and giving a good stretch to both soleus and gastrocnemius mostly. And so obviously the opposite is true as well. You can, if they have tight tibialis anterior that's pulling them and keeping them more into dorsiflexion, and they don't have, which she obviously doesn't have a problem with that, hers is the opposite direction. But if she did, stabilize here and push them more into plantar flexion because they're stuck in dorsiflexion, and stretch that tibialis anterior. So hand position here. You can also do the same thing with the ankle everters and inverters. So if they have tight everters and they're not able to move into inversion, kind of stabilize here and push them more into inversion, hold for 30 seconds, then relax. And then the opposite direction, I kind of like to grab on the heel again and use my arm to kind of push them into eversion. It doesn't really matter a whole lot, just make sure that you're not, you want to support as much of the joint as you can, and because you don't want to push here because then you're putting pressure on the bones of the foot. Now, as far as stretching goes, is you literally can put a person in any position and still stretch them. You just want to make sure that they're comfortable. So I've mostly had her lying the whole time because it's a lot more comfortable for the patient and it's easier for them to kind of relax, because one of the keys is you got to get the patient to relax. If they're fighting against you, your stretches aren't going to be as effective. So those are pretty much the manual stretches for the upper extremity and the lower extremity.